Hello, and welcome to our webinar on recognizing the impact on students. Please feel free to say hi in the chat. Let us know what district or agency you're from. We love to see and hear that there's people from the state of Oregon joining us today. My name is Yesenia Ayala, and I'm part of the WestEd team, and I will be providing some framing for today's session. Today's webinar is presented by the Oregon Department of Education and WestEd. A couple of housekeeping items. So during the session, participants will remain muted with their video off, but are invited to engage with us by sharing comments via the chat. Also, please feel free to submit questions for our presenters via the Q&A feature. This session will be recorded and posted in ODE's K-12 Substance Use Prevention and Intervention webpage, and also to ODE's YouTube page. Now, we have 60 minutes together today, and our session objectives are to review the signs and symptoms of opioid misuse and overdoses among students, explore the scope and impact of the opioid epidemic on students' health, well-being, and academic success, discuss current evidence-based strategies and programs to prevent opioid misuse, including promoting healthy coping mechanisms and fostering supportive environments. So we have a very exciting agenda for today and a lot to cover. So we'll start off with some welcome and introductions from our speakers, and we will discuss the importance of language, in particular strategies for discussing substance use in a school setting. We'll also have a section on alternatives to discipline for substance misuse. And we'll include an introduction to the multi-tiered system of support model. We'll also discuss opioid awareness in schools, and we'll have a discussion with Mary Stevens-Crow, who's one of our guest speakers. And then we'll wrap up with an audience questions. So we do want to make sure that we share that this webinar will cover sensitive topics related to opioid misuse prevention, the trauma associated with the opioid epidemic, and its impact on students in the state of Oregon. We do want to emphasize that the discussion aims to equip educators with effective planning strategies while still emphasizing the importance of inclusive and non-shaming language. And lastly, our goal is to create a respectful, supportive environment for learning and collaboration. So some content may evoke strong emotions or discomfort, and we want to make sure that you are taking care of your well-being. So if you have any concerns or need support, please let us know during or after the session. Now I will pass it over to Alana Russell from the Oregon Department of Education.
Hi, everyone. My name is Alana Russell, and I am the Substance Use Prevention Education Coordinator with the Oregon Department of Education. At ODE, we serve over 560,000 students across 197 school districts. Our mission is to foster equity and excellence for every learner through collaboration with educators, partners, and communities. Specifically, my role here at ODE is to provide technical assistance and support for school districts related to substance use prevention and intervention, as well as serve as the state-level point of contact and liaison for school substance use prevention work. As part of this work, I have been fortunate to collaborate with WestEd to develop this learning series and a suite of other resources designed to support school districts across the state in substance use prevention efforts. I'm very grateful to be joined by you all today. If your learning leads to additional questions or ideas, I really encourage you to reach out to me. You will be provided with my contact information in a follow-up email. You're also invited to reach out to me if you would like to receive professional developed units for this event. And I also have the privilege of introducing our guest speaker for today, Mary Stevens-Crow. Mary is a licensed clinical social worker, licensed school social worker, and licensed K-12 school administrator who has been working with youth and families for more than 2 decades. She is currently the district coordinator of substance use supports for Portland Public Schools, that includes managing the treatment supports, psychoeducational interventions, and prevention programming. She has also worked in a large variety of public school settings that emphasized engaging families, systems, and providing support and programming at multiple levels. She served as a member of the Oregon School Social Work Association for over 12 years as a leader and is also on the National Legislative Committee for the School Social Work Association of America. We are grateful to have Mary join us today in our guest panel at the end of today's session. Thank you, Mary.
Thank you, Lana and Yessi. So my name is Derek Lowry, and I'm going to introduce the West Ed team here on this webinar. So I am a Senior Justice Technical Assistant Specialist with West Ed, and my two colleagues here, Dr. Loeffler Kobia is the Director of Justice and Public Health Policy and Practice, along with Colin Carter here, who is a Research Associate. So today we will be participating in this webinar and speaking. So, WestEd, we are a nonprofit research development and service agency dedicated to improving education, health, and human development outcomes for children, youth, and adults. We have a focus on research and evaluation, professional development, and providing technical assistance, or TA. We support schools, districts, states, local governing bodies, and local and national organizations in implementing effective strategies and evidence-based strategies. And our key focus areas include education, health, and well-being, and improved justice outcomes for all. So for the first part of our webinar here, we're going to do a little fun activity that is a fact or myth activity. So I'm going to make a statement with the first slide here, and then we're gonna throw a poll up. We would like you to tell us whether you think that this statement is a fact or a myth. So opioid addiction only affects high-risk youths who are already in trouble. Do you all think this is a myth, or do you think this is a fact? Okay. Go to the next slide, please. So 100% thought that this is a myth, and so 100% were correct. This is a myth. Opioid addiction and misuse can affect any youth, regardless of their background, their socioeconomic status, or their personal circumstances. Using non-judgmental language helps create an inclusive environment where all students feel supported, and we are going to get into that a bit later. The next statement, using strengths-based language can empower youth struggling with substance use to seek help. Using strengths-based language can empower youth struggling with substance use to seek help. Do you all think that this is a fact or a myth? Okay, let's end the poll. So 97% think that this is a fact, and you all are correct. This is a fact. Strengths-based language focuses on individuals' abilities and potentials. It encourages positive self-image and the motivation to pursue recovery and support and to be open with peers and adults and teachers. Thank you for participating in the poll. It seems like most of the audience is familiar with the topics we're going to be covering. So the first section here, language matters, strategies for discussing substance use in a school setting. And in this section of the webinar, we're going to explore the vital role of empathy and language strategies when discussing substance misuse with students. By fostering an environment of trust and understanding, we not only help students feel safe and valued, but we also encourage them to share their experiences pretty openly. So before we jump into the material, we're going to have one more poll. Do you think discussing opioid use openly in schools leads to increased curiosity and more experimentation among students? Do you all think that just discussing the topic of opioids leads to increased curiosity and experimentation among your students? What are your thoughts? Okay, in the poll, let's share the results. So 97% said that no, discussing opioid use in school will not lead to increased curiosity or experimentation or use, while about 3%, I think one or two people thought that perhaps it did. And the data behind that actually says that it does not lead to increased curiosity and experimentation. So for our next section here, we're going to cover these three topics. So our focus is going to be on these three key approaches, using non-shaming language, implementing trauma-informed strategies, and adopting strengths-based perspectives. We'll explore the significance of language that avoids blame and judgment and ensures that students feel respected and understood. We'll also discuss strategies to recognize the signs of trauma and respond with sensitivity to prioritize students' emotional safety in these discussions. And we will also explore methods to highlight personal resilience and empower students to find positive pathways forward. So how to use non-shaming language. So I want to note that it's important to recognize how the words we choose can profoundly impact students and individuals dealing with substance misuse. According to the National Institute on Drug Abuse, using person-first language and avoiding stigmatizing terms can foster a more supportive and respectful environment. Having said that, I want to say that we should remember that the words we use and how we use them matter, especially to the person we're speaking with. Our language should show compassion and care for individuals impacted by substance use disorder. As I just mentioned, using person-first language lets students and individuals choose how they are described in that context, and using non-shaming language that reflects an accurate science-based understanding of substance use disorder that's consistent with our roles when we're discussing these topics with students who may be in need. Some examples of that would be that instead of using a word like habit, in a discussion, use substance use disorder or substance use condition. Habit downplays the seriousness and complexity of addiction, and it's better to frame addiction as a health condition. In place of addict, you can use person with a substance use disorder. This wording emphasizes the person rather than defining them by their condition. And I want to say, I think that in striving to use non-shaming language, we want to keep in mind that it's important to use language that reflects a science-based understanding in these conversations. For example, instead of implying moral failure or assigning blame in these conversations, we should discuss substance use disorder as a chronic disease that requires treatment and support, since this aligns with scientific understanding and aids in reducing stigma and promoting an informed perspective. So a trauma-informed approach to engagement with students. So for this slide, let's delve into the significance of a trauma-informed approach in educational settings. Knowing that many students facing substance use issues may have experience of trauma, it's pretty essential to respond with sensitivity and understanding. So it's important to recognize the prevalence and impact of trauma on individuals and to strive to create an environment that promotes healing and safety for that individual. We can build trust by establishing a safe and supportive relationship with that person. So it's important to incorporate voice and choice, which gives the student the opportunity to express feelings and it fosters empowerment in that student when discussing this information. It's important, just like on the last slide, to minimize triggers in language use and in the teaching environment. And we want to ensure that staff and teachers are educated to recognize and respond to needs of students without being punitive. I think additionally, we should also recognize that trauma can significantly affect a student's behavior and that student's coping mechanisms. We as educators should try to be aware of the signs of trauma and how they manifest in students' interactions and learning experiences. So a strengths-based approach to engagement. For this slide, we'll explore how educators can focus on students' strengths and capabilities, especially when addressing substance misuse issues with them. This approach not only supports students in overcoming challenges, but it also fosters a nurturing environment where healing and resilience can thrive. So it's important to focus on the inherent strengths and the potential of the student and the individual rather than their challenges. It's important to regularly acknowledge and celebrate students' achievements as opposed to student failures. And it's also important to set collaborative goals with students that align with their strengths and their interests. Linking students to activities, mentors, and programs they're interested in will encourage growth and them opening up as well. So for the next section, we're going to go over alternatives to discipline for substance misuse and what that looks like in Oregon. So this chart here is a data chart covering discipline incidents across all grades for students in Oregon, for all students in Oregon. As you can see, there is a dip in 2021, and then it goes back up through 2023 and 2024. So that notable decrease that was reported during 2020 and 2021 was because of a shift to remote learning. I'm sure we all remember the COVID pandemic hit during that time, so students were typically not in a school setting. When the data from the pandemic years is actually set as an outlier and removed from this chart, the analysis shows an overall increase of 13% from 2019 to 2023. And this increase in substance misuse incidents goes from 8,727 cases in 2019 to 9,840 cases in 2023. And here are once again some disciplinary incidents in Oregon broken into grades. And all of these are disciplinary incidents for substance misuse in a school setting. So substance use related disciplinary incidents are higher during the middle school years. There's an upward trend among middle school students and a downward trend among high school students. And the downward trend begins around the 9th to 10th grade and continues to decline from there. So the peak seems to be during the middle school years. So let's quickly look at the effects of school suspensions on youth, the consequences of school suspensions on youth, and what some alternatives to discipline can be. The effects of school suspensions on youth. So those are diminished academic achievement for the students, an increased risk of dropouts, and a heightened likelihood of future criminal behavior. The consequences for school suspensions are an exacerbated educational disparities amongst students. These suspensions typically affect more vulnerable students disproportionately, and high-risk students face more suspensions and expulsions through consequences for school suspensions. And when we consider alternatives to discipline when possible, those can be restorative practices, access and advice from health counselors and services for students, and educational resources being provided in lieu of punitive actions or disciplinary actions towards a student. So can you take a moment? I'm curious if you are surprised by this data, if the data isn't surprising, and maybe you could just share your thoughts in the chat with the other attendees here. Okay, I see some folks are not surprised by the data. A few folks are saying that they're not surprised. I see that one person is sharing that they are surprised that the dip begins around the 9th and the 10th grade. Quite a few folks attending seem to be surprised by the peak for the middle school years and students in Oregon. Somebody notes that their own school district is also seeing a drop around the 10th grade. So you can continue to share your thoughts on the data in the chat, and we are going to transition to my colleague Colleen Carter to cover the next two sections.
Thank you, Derek. Hi, I'm Colleen Carter with West Ed, and so I'm going to talk next about the multi-tiered system of supports model. We call this the MTSS model. So this is a proactive and preventative framework for organizing mental health systems. It helps at a system level built on a foundation of looking at professional development, strong community partnerships, and also continuous improvement. There's four essential components to this. It includes screening, progress monitoring, also a multi-level prevention system, which I'm going to talk about in a second with the 3 tiers. And also it's built based on database decision making. So as you can see we have you can call it a triangle or a pyramid, whichever way you want to look at it. And so from this, we have three tiers. The bottom tier is tier one. This is your primary prevention, your universal strategies to help promote all students' mental health. And then you have your secondary prevention, tier two, which is more targeted therapies. This includes things such as initial risk assessments, check-ins, resource planning, strength-based small group therapy, and also includes that coordination with referred providers. The third tier is your intensive services, your crisis support. So these are targeted referrals and services for students that are dealing with serious mental health or health concerns that could impair their daily functioning. And this could include referrals out to individual family therapy or substance use treatment. Or in this case, it was mental health treatment, but that leads me to the next slide where I want to talk about now let's take that model, the MTSS model, and build it for substance use. So this is what it would look like. So you're going to have your three tiers again. We have a triangle or pyramid, however you want to look at it. And in the bottom one, we have our tier one, which is going to be your prevention education, your staff trainings, and also consistent messaging. In the second tier, you have your targeted interventions, prevention groups, support in student planning meetings. And then for your third tier, you've got your assessment referrals. This would be individual counseling or family case management to support higher levels of care. And the most important thing I want to mention is that this has, we want to have this to have consistent support structures in place, but this also allows flexibility to adapt each school and community based on your own unique needs, and also including student and family voice in that process as well. So then now let's move on to opioid awareness in schools. I want to talk a little bit about this, the importance of opioid awareness and identifying it in the school setting. So we have some statistics here. We have the most recent statistics were for 2023. We don't have 2024 yet. But what's really important to understand here is that young people aged 10 through 24 have the third highest rate of opioid overdose fatalities of any age group in Oregon. And in 2023, there were 86 opioid overdose deaths among 10 to 24-year-olds in Oregon as well. And also over 90% of youth with substance use disorders are attending K through 12 schools. And so this is really important for us to understand because now we're going to go walk through some examples of other school-based opioid misuse prevention strategies that are being implemented. One of them is programs. So programs to improve student mental health, school climate, screening and referral to other support services. In addition, you have instructions on the risks of illicit drug use and prescription drug misuse. Also, student engagement's really important in the design and implementation of prevention programs, and also creating school-based messaging materials, along with formal and informal collaborations with community partners. That relationship with your community partners is important, especially when you might be in a smaller rural area where maybe you don't have as many resources available. So having this built within that framework that we talked about earlier, the MTSS model, is really important. So now I'd like to talk a little bit. You might be asking yourself, how do I recognize the signs and symptoms of opioid chronic use or current impairment? So since schools are the primary first tier to helping advocate for young adults by seeing the warning signs sooner, here's a few ways you can recognize them. So some signs of chronic use could be frequent absences, lowered motivation, irritability or mood swings. And some signs of current impairment could be slurred speech, shallow breathing, euphoria, which is feeling high, or unusual drowsiness. But an important thing to mention here is this could be any of us, because just because someone has irritability or is absent from school doesn't necessarily mean that they're have an opioid use disorder. So we just wanted you to be aware of those signs and symptoms, which leads to our next slide. So now the question would be, what should you do if you recognize or see some signs that kind of alert you to being concerned? So ways you can act on that would be keeping lines of communication open with students. The teachers and students have the closest connection, and so asking students about their lives, know how students talk about, if you're hearing them talk about substance use and addiction, being aware that they also might be living in environments where they're exposed to opioid use by others. Next, we want to look at communicating. So communicating those concerns about students to others, communicating with the school and district support staff or possibly parents and caregivers. And third and last, offering support, having those available resources available to share with young people, and also knowing what your district and school referral practices and policies are. So now I'm going to go ahead and open it up and pass it over to our guest speaker, Mary Stevens Crow, for a Q&A session with my colleague, Derek Lowry.
Thank you, Colleen. And I just want to remind the audience that Mary is the Portland Public Schools District Coordinator of Substance Use Supports. And she's also a licensed clinical social worker, a licensed school social worker, and a licensed K through 12 school administrator. Mary, thank you for joining us. So as Mary and I are having this conversation, I also want to invite the audience to share questions in the chat that if we have any time permitting at the end of this, we will also ask Mary or myself to answer. So any audience cues, please drop into the chat. So I guess to get started, Mary, my first question for you is what role do educators and school staff play in identifying and addressing substance use issues among students?
Well, thanks for having me, Derek and Wested and Alana. I'm glad to be here. I think we play a really, really important role. We're on the front line along with families, noticing changes in students, having really important relationships with students. And then I think school staff are uniquely positioned to work with community-based organizations and partners to be able to help students and families navigate to those services, whether it's for mental health or for substance use.
Thank you. Can you share any successful programs or initiatives that have been employed to promote healthy coping mechanisms in students? And also any other maybe services or programs or CBOs that you kind of just hinted at connecting students to and families to that could be helpful?
Yes, first I want to qualify by saying, a lot of our partnerships are in the Portland area. So that's important to know because I've noticed we have a lot of people from rural Oregon, and what the service and support landscape looks like there is really different than what it looks like in the Portland metro area. One thing that's been really fun to work on this year is there is a small organization in Portland called Push Recovery, and it is recovery skateboarding. And it took lots of meetings and conversations and reviews of releases of information. And then we have two of our high schools that are now, because of the high school rebuilding project in Portland, are in close proximity to each other. And we have a recovery skateboard club that happens on Thursday afternoons that draws students from both campuses. And that took administrators at both buildings that wanted it to happen and were really supportive of the idea. And then social workers, actually, it was the social workers at both buildings that helped us do some recruiting, that helped push recovery table at lunchtime to recruit students and get it started. And so that's been really fun to work on this year. I think another thing that has been really important for us is Portland Public Schools employs certified alcohol and drug counselors, and they're critical staff in our buildings, but we only have funding for 3 of them, and that's not enough. We have 10 high schools. So we also work with community-based organizations that also provide certified alcohol and drug counselors in buildings. And that has been an essential partnership in us being able to respond to low-level discipline and connect students with supports.
Yeah, that's really awesome. I guess a smaller follow-up question is, do you feel that some of the community-based organizations and service providers can fill that gap that may exist for some school districts when they're offering resources and services?
100%.
Okay.
One thing I notice when I talk with school staff is sometimes there's some anxiety about talking with students about directly about if they are struggling with substances. And what I say when I work with student service teams, counselors, social workers, and then occasionally when I'm presenting in front of teachers is you all don't have to be experts on substance use because that's a huge job in and of itself. You just have to know where those services are in your community. And if you're a teacher, you just have to know who the connector person is in your building to get students connected. And a lot of times that's a school counselor or a school social worker.
Yeah, thank you for sharing that too, Mary, because that's such a good distinction. And I think it takes a lot of the pressure. Teachers are already doing so much for the youth and in school settings, so it can take some of the pressure off of teachers. Again, like you just noted, who aren't really trained to do that, but who can
Mhm.
very easily coordinate and connect students and families to services when those services are within the district, within the school, within the wider community. Thank you for sharing. That was a great answer. Our next question is kind of following up on these first two. How can schools create environments that help prevent substance misuse and promote student health and well-being?
Well, I saw my colleague from Portland Public Schools is here, Dana Reamer, and he's one of the district's discipline coordinators. And I named Dana because we did some really important work together with support from really the top administration in the district. And we redid the district's drug and alcohol policy about 6 years ago. And we framed it on what we wanted to see happen instead of a policy built on a long list of things that you don't want to have happening. And then we really centered connecting students with education interventions and supports and really tried to avoid out of school discipline. And I like talking about this with other district staff because having a policy that backs up that the work that you're doing is really foundational in changing the climate in your school district and their response to drug and alcohol issues.
Thank you. Yeah, that was also a really good answer. I'm curious about when it comes to connecting, and this is sort of an additional question to follow up on this one, but when it comes to connecting students to those resources, w- is it easier for to just to create that sort of open environment and that safe environment for the students to come to the teachers, or is there a way for the teachers to promote the access of resources to the students in a different way or a different tactic?
I don't think it's one or the other. I think it's both and.
Okay.
And so, I mean, substance use and thinking about preventing substance use is, of course, like my highest priority and what I think about all day long. So I would love it if at the beginning of every school year, when teachers are getting up to speed on all the resources, they're also getting some basic information about how their school is going to respond to those concerns. So that's part of it, is giving teachers some basic information so that they're more comfortable addressing those issues. And so they know there's a plan about
Mhm.
how to respond. And then I think having designated staff, if you're a smaller district, then maybe it's one person in the central office, um, or it's a counselor or a social worker that's going to work on having some relationships with community-based organizations so that those supports can actually be in your building and available for students to access on their own, for parents to call and consult with. It's great having that, being able to share that out with your community.
Thank you. So yeah, so it sounds like there's just different ways to do this for each school and each district, and they have to figure out the best way to promote the information and to connect families and students to it. Um,
I was
Since
going to
you,
say there's different ways, and then there's
Mhm.
you don't want to just try and hit it from one angle. Like if
Okay,
you're really going to address substance use, you have to think about how are we going to get teachers information? What are we talking about in health classes? How do we make low-level services available in our buildings?
okay. That makes a lot of sense. So there's just a lot of different ways to go about it, but then like you have to step back and figure out multiple strategies that you can employ. You brought up community in that answer too. So I want to ask you, how important is community involvement in supporting district efforts to combat the opioid crisis, but also substance misuse generally? And what steps can local communities take to support students? So kind of looking at it from the community perspective as opposed to the school perspective.
Well, we can't do it without our community partners. I feel real clearly that, schools are educational institutions, not drug and alcohol treatment programs. And
Mhm.
so it's essential that we work with community partners. I think one thing that community partners can think about when approaching schools with a program that they have is remembering how much schools have on their plates. Um, they're not just doing opioid intervention training. They're also teaching reading, math, writing, helping people get ready to graduate and have jobs in the world. Their plates are really full. And so having reasonable expectations about how school districts can partner with you, I think is a really important piece in working with school districts and educational entities.
Okay, thank you. And are there any partnerships or collaborations with local or national organizations that you can cite or discuss that you've worked with or that have helped support initiatives in your school district in the past?
Um, I know that this session is more focused on opioids, and I checked today before I say was going to say their name in this training because I didn't want them to get overwhelmed. We PPS had a small contract that was really helpful for us with Project Red of the Alano Club that does training on opioid intervention. And it's an excellent training, and people can ask a lot of questions. And they've done trainings for our high schoolers and different staff groups. And they're amazing. And they do virtual trainings, they do in-person trainings. Um, so I really appreciate the Alano Club. And then NARA Northwest is another organization that we've had a long-standing partnership with. They are providing both mental health supports and substance use supports in our building. And they're also able to offer really culturally responsive services for our Native and Indigenous youth when we have those students that need that.
Mhm. Thank you. And I think somebody also mentioned NARA in another organization you cited in our chat as well. Um, Can you talk a little bit about the MTSS model? Like, how is the model integrated into your approach to substance use prevention and support within public schools in Oregon? And this is the model, everyone, that my colleague Colleen covered just
Mhm.
previously.
Yeah. Well, the model is, my work all day, every day. And when I'm talking with school teams and they're putting a ton of time and energy into tier 3 or maybe tier 4 students, I always want to encourage them to get back to tier 1 if possible and tier 2. So when you have lots of students that you're concerned about that are using or a social group of students that is really connecting around substance use, I always want to pull teams back and say, what are you doing at tier 1? How are you providing education information for students? And then how are you drawing students in to help inform what is most critical and important to them? like where is student voice in this?
Hmm.
Because they have so much insight about what's going to be the most relevant for them. I think another thing that we can do at Tier 1 is make sure that we're talking regularly and consistently to families. So, are you putting stuff in your principal's news bulletin once a month? Are you partnering with outside organizations? Are they either coming to back to school night, or are you doing like a mental health substance use information night? Like, how are you drawing them into your buildings and giving families chances to meet staff and find out about different programming?
Thank you. You brought up students, and I don't think in the sessions that we're doing in these two so far, we haven't had a chance to really talk about student voices, but do you see a lot of initiatives or programming around general substance misuse or fighting opioids that are more student-led and student-informed in public schools or just generally in the state?
Um, well, there is PPS just got a drug-free communities grant from the CDC, but we join a group of nonprofits in districts around the state that have already had those grants. And drug-free communities grants are focused exclusively on prevention. You can't use those dollars to backfill, for counselors or
Hmm.
direct service providers. And one of the things that we're going to be doing with our Drug Free Communities grant is really thinking about how to encourage and build youth leadership and bring that into the conversation at our different high schools. And then the amazing thing that we've had happen, and I know this is happening around the state, is we've had youth leadership groups like spontaneously form and they find me and ask
Mm.
me what resources are available. And so one of the things that we hope to do with our Drug Free Communities grant is be able to give them more resources and trainings. And a big partner to PBS in doing this work has been Multnomah County
Hmm.
and their prevention office.
Hmm. Thank you for sharing that. I'm curious when students connect with you to find resources and to have these discussions with you. How do do you know how they are promoting resources and strategies amongst their peers?
I I always ask them that. I'm like, I bring them pizza and I'm like, tell me how you're doing it. Um, Well, they're much more tech savvy than I am. So they use a lot of social media. They've got a lot of great ideas about how to do things that are engaging. Some of our high schools host wellness fairs. They want their youth groups to be front and center at different wellness fairs. Um, yeah, they just do a whole range of really great things. There's a student leadership group at Franklin that is going to go and do presentations in all the health classes. And that's required a lot of planning, a lot of preparation because Franklin's really large. There's a lot of
Hmm.
health classes. There is a group at Roosevelt that did focus on peer-to-peer intervention with like how to help your peers if you're in a situation where people are drinking and how to help
Hmm.
your peers say no if they need to. And so, yeah, they've been, they're really inspirational.
That sounds inspirational. Do you find that, and you may not know, but I
Mhm.
wonder if their peers, the other students, are more amenable and open to opening up to other students with these issues instead of maybe to educators and adults at times.
I know 100% they listen to each other more, they
Mm.
trust each other more. And I love it when I support the youth groups, I'm like, be sure and mention that there's a drug and alcohol counselor here on campus that students can get to because I can say it all day long. But first of all, I don't work in your building. And then the other thing is, I'm relatively old. And so I'm not nearly as trustworthy as you all are.
Thank you for answering my additional questions too, Mary. So this has been a very good conversation. Thank you for sharing your body of knowledge with us and your rich history of work in Portland Public Schools and in Oregon generally. I wanted, before we ask the audience, well, I actually would like the audience, if you can, if you have any questions for Mary or myself, please drop them in the chat and we will do our best to answer them because we have a few minutes left before we close. But Mary, is there anything else you would like to share or cover that I didn't get to through a question that you think might be useful to the audience here?
Yeah, I recognize that PPS being the largest district in the state has access to resources that many of the smaller districts in Oregon don't. And I also know that Oregon is mostly made up of small districts. And so, one thing I would really invite smaller districts to think about doing is to tackle these projects one at a time. So if you really want to change how the district's responding to low-level drug and alcohol violations, if you want to do something besides suspending, start there and bring together a multidisciplinary team and think about your drug and alcohol policy and how to center interventions. Work on that for a year. If you really want to have services more readily available, start there and work with some outside organizations to bring them into your buildings on Thursdays to help with services. And just really don't feel pressure to do it all at once, but figure out where you can start.
Thank you. Um, at this point, can we share the audience? Thank you. So at this point, I'd like to open it up to audience questions for our guest speaker and for us generally, if you have them. I will start as you all come up with some questions. If you have any additional questions for us, I know one question that we did get in the chat was: is there a difference in the substances being used in middle versus high school? So, is there a difference in the substances being used in middle versus high school? Yes, there are differences in the substances that are commonly used between middle school and high school students. And I believe the trends generally show an increase in both prevalence and variety as students progress to higher grades. For example, tobacco, marijuana, alcohol, and vaping are common among middle school students, while high school age students start to use more illicit drugs as they get older. So that was one question that we had that I thought was a very good question. Are there any other questions from the audience that you all may have? We have a few minutes that we could answer them if you could just drop them in the chat. I know that we had, I think, another question perhaps too here about grouping data on 10-year-olds with data on 24-year-olds is not as helpful for understanding the issue as looking at it. Ages 10 to 17 youth and then 18 to 24 for young adults. I think that is a very good point. I just wanted to highlight the point, and I'll say that it is good to see a breakdown by age groups. Those do present a much clearer picture of how the general substance misuse and opioids generally are impacting youth versus adults. But when that data is available, I'm not sure that all of that data was publicly available to have access for. Was there
I think
another?
one thing
Go
I'll
ahead, Mary.
say that's tricky in Multnomah County is when they talk about opioid overdose deaths, they group youth. They say youth go all the way up to the age of 24. And that is that is a scary statistic, and it's a little bit confusing because there's a big bump in overdose deaths after the age of 18.
Thank you for jumping in there, Mary. On our first learning session, we even kind of highlighted that jump begins around that age, but also that 10 to 24, I think, is the third highest rates of opioid overdoses in the state, with 25 to 39, I believe, being the highest, and it's amongst males. So kind of like we just said, the different types of data we do have access to absolutely paint a clearer picture. And as they get older, specifically the 18 to 20 24-25 and then 25-39, you do see specific jumps in opioid misuse and opioid fatalities and hospital visits and emergency department visits.
Yeah.
I think we may have another question from the audience. This is a question for Mary. So how is your work, how is this work being impacted by federal policy shifts?
Well, I think the most direct answer to that is right now we don't know. And so the Drug Free Communities Grant is from the CDC, and we were awarded that grant in early September. And we've definitely seen challenges with the CDC being able to support the rollout of all the new grants that they awarded because of executive orders and shifting policies, and then subsequent lawsuits around the policies. So I feel like it's still continuing to evolve.
Okay, thank you for that answer. There's also another question, I think, and it goes back to the prior question about the data, and you highlighted more opioid use and fatalities around 18 and up. And someone just wants to, there was an additional question wondering whether you kind of see the evolution of different illicit drug use and more impacts in the work you do as the students are getting older.
Yes, definitely. By far, one of the best data points Portland Public Schools has, and most districts have, about what students are using is discipline data. And so by far, over 95% of our discipline is for legal substances, nicotine, alcohol, and cannabis. And cannabis by far is the one that students use most often. And then definitely we see middle schoolers starting with nicotine and vaping products, and then their use progresses over time. And then something that I've heard over and over from my colleagues that are addictions counselors is most young adults and adults that have addictions issues started using before they were 14. And
Okay.
so I like the idea of thinking about tier one interventions and supports for families being focused on not really getting it so kids don't ever use, but delaying that onset as long as possible, because we know that that is tied to more time for prefrontal development as
Mhm.
well as decreased risk for addiction.
Okay, thank you, Mary. That was a very good answer. So we only have about 2 more minutes for audience questions, but we have a pretty good question here. And this question is for you, Mary, or for my colleague, Dr. Lafleur-Cobia. And it's a bit of a big one, so you can also, I think, access it in the Q&A box, and I'll read it to you. So the work of Johan Hari and others argues that the opposite of addiction is not sobriety, it is connection. This audience member wants to know if that is so, does that argument hold any sway with administrators who use social isolation and suspension to respond to substance use issues?
Well, again, having a policy that really minimizes out of school discipline is a great way to balance out an administrator whose go-to might be lengthy suspensions. And then our primary intervention, the first time that students have a drug or alcohol violation, is 6 hours of a psychoeducational course that I manage. And students have to attend with a parent or a caring adult. That's our first level of intervention, as opposed to 2 or 3 or 5 days of suspension. Then having substance use counselors embedded in high schools that have relationships with the high school counselors and social workers, and those connections with students are easily made, is, I think, another way to get at that connection as the antidote to addiction.
Thank you so much, Mary. And we have to end our audience Q&A at this point. And I just want to say, Mary, thank you so much for being our guest speaker on this learning session and for sharing your experiences and your work in this space with us. And having said that, I will turn it back over to Yessie to close us out.
Thank you so much. So first of all, thank you to all of our amazing presenters today. And as I mentioned in the beginning, this was actually part of a series of virtual learning opportunities. So the next one will be on May 21st on what's happening now in Oregon, current landscape of prevention and treatment resources. And then we have a learning opportunity session for scheduled for May 28th. So we invite you to register for other sessions using the QR code on the screen. So again, this was our second one. We still have two more, and we'd love for you to join. And then lastly, we really want to thank you for being here today and asking all of the questions that you asked and being so engaged. And we really value feedback. So we would appreciate if you can please complete our follow-up survey. You can find the QR code in on the screen. And my colleague is actually just posted it in the chat as well. So please respond to the survey, and we look forward to hearing your thoughts. Again, thank you everyone, and I hope that you have a great evening.